Hi, Dr. John Torres here with NBC News on this Facebook Live, giving you an update over the headlines over the weekend, things you might have heard about, and getting more detail behind the scenes there, getting you more information what that headline means to you, and more importantly, what it means to you going forward here to help you, your loved ones, your family, your community get through this pandemic sooner rather than later, and then taking your questions and answering as many of those as I can. So while I'm giving these headlines, if you have questions, please send them our way, and we'll get to those as we can at the end of this once I'm done with the headlines. But let me talk about those first. And first and foremost are the numbers we're talking about here. And the numbers, if you've seen them, have been very, very high, record highs in some cases, which is very unfortunate. But this is not something unexpected because we knew from the holiday travel, going from Thanksgiving through all the December holidays, that we would see increases in numbers. And we're starting to see that right now. Today's January 11th. And so we're at that week and a half time period, 2-week time period. We're going to start seeing the peaks in those numbers. And so we're not quite there yet, but we think we will. But these are peaks in numbers of cases, because what typically happens is cases occur 2 weeks after somebody travels or during this holiday travel season. And then 2 weeks after that, so at the 4-week point, we start seeing increases in hospitalizations, which are already in some places inundating hospitals, overwhelming hospitals, especially in California. And then 2 weeks after that, at the 6-week point, we start seeing increases in deaths. But we've already started seeing record numbers of all those. And so that's the concerning thing with a lot of experts. Are those going to continue to go higher? And we're going to see more and more of those, both inundating our healthcare system and causing more complications and unfortunately more deaths. But looking at the numbers, so 2 days ago on the 9th, we had 278,000 cases of coronavirus in this country and 3,603 deaths. At 278,000 cases, that was a record high since the start of the pandemic. That's over 250,000 people in this country were diagnosed with coronavirus and had coronavirus. And if you look at the numbers overall, here in the U.S., since the start of the pandemic, we've had 22 million cases and unfortunately 374,000 deaths. If you look worldwide, when it comes to worldwide, there's been 90 million cases, almost 2 million deaths worldwide. And so again, 90 million cases were 22,000 of those. And when it comes to the death rate, 1.9 million deaths, almost 2 million deaths, and we're at 374,000. So you can see we're a big majority of what's going on around the world, and those numbers continue to go up, and like I said, will probably continue to go up. Yesterday, numbers dropped a little bit, 220,000 cases around there of coronavirus here in the U.S., 1,800 deaths. The deaths did drop off, but we expect those to go up again, like I said, because deaths typically lag hospitalizations. Hospitalizations typically lag cases, and we're seeing those numbers of cases going up right now. And so we do think we're going to see rises in both hospitalizations and cases. To try and help out with that, obviously, we do the things we need to do, which I call the 4 W's. Wear a mask, watch your distance, wash your hands and windows, ventilate. Avoid large groups. Don't go into any kind of gatherings. Avoid going out any more than you have to. And those are ways we can keep it under control. But one more tool we have in our tool bag to try and help out is the vaccine. And we know the vaccine is here. Moderna and Pfizer have both been approved. We're looking at some other ones, particularly Johnson & Johnson and Novavax, we think will be approved probably this month. AstraZeneca, maybe April time frame. So we're going to have, hopefully by springtime, 5 vaccines in this country with millions and millions of doses being manufactured. Problem is right now we have over 20 million doses, but just over 6 million people have been vaccinated. So there's a problem in the lag in vaccinations. So people aren't getting vaccinated even though there's dosing out there. And as a lot of experts say, a vaccine in a refrigerator or freezer does us no good. It needs to be in somebody's body in order to help keep them from getting COVID-19 and hopefully help them from spreading COVID-19. So what's going to go on here? Well, we're transitioning to a new administration. Operation Warp Speed up until now has said basically here's what their policy has been. They'll get doses of the vaccine and they'll save half those doses for a second dose for people. So let's say they have 40 million vaccines. They'll save 20 million. They'll send out 20 million. So 20 million people can get vaccinated. And in reserve, they have those other 20 million dosings because people need the second vaccine. And that way it's guaranteed they can get that second vaccine. Now, with Pfizer, they need that 21 days apart. With Moderna, they need that 28 days apart. So you can see that there's a little bit of a lag there, 3 weeks to 4 week lag there. Well, the Biden administration is coming in and they're saying what they think they want to do, at least they're talking about at this point, is they want to go ahead and release all 40 million of those vaccines so people can get them, many, many more people can get them, and it's a bet. They're betting essentially that manufacturers can, in the meantime, in that 3 to 4 week time period, can manufacture enough to get people that second dose at the same time that first doses are being given to a lot of other people. And so it is a bit of a bet on their part, but there are a couple of things we know. Number one, we do know that first dose does give you a little bit of protection. Seems to be around 50% protection from the vaccine, from the virus. But what we don't know is how much does it give you protection for? Does it last longer than the 21 or 28 days? Because that's all that was studied. And so they're looking at that now, but manufacturers have said, wait a minute, we only got the emergency use authorization. The FDA is saying, wait a minute, we only gave the emergency use authorization for either that second dose at 21 or 28 days. It shouldn't be delayed. And so that's the risk there. Give all the doses out right away and hope the manufacturers can manufacture more. A lot of health experts are saying it's worth that gamble to get many more people vaccinated. But remember, too, at the same time, and this is a complicated fact here, this is a complicated thought process they're going through, is there are a lot of vaccines that are sitting in refrigerators and freezers that haven't gotten out there. So even though the vaccines are there, the logistics to administer the vaccines aren't there yet. And so it might be jumping the gun a little bit at this point to give everybody, to release all those first vaccines when we're having trouble even getting out the amount they have now. But if they can work that out, this might be something that can be very beneficial, get more people vaccinated, that first vaccine, which then hopefully they come back for their second vaccine and get that full protection. So that's the debate going on right now. And this week and next week, the Biden administration is next week. So this week and next week, we'll find out more information about this. And when I find out more, I'll let you know as well what's going on. Now, the other complicating thing is the CDC came out with their recommendations for vaccines and what's going to happen there. And what they said is, certainly there's certain phases for certain people. Well, then they said, okay, the states can decide on their own. These are just guidelines. Well, one of the issues has been all the states are doing it differently. They're deciding based on their own issues, their own concerns, and those are being different across the country. So it gets to be very confusing how the phases are. Some of them have basically gone outside the phases and a little bit. Others are bringing people in that might not be in a phase necessarily because they think they need the vaccine sooner than people that are inside that phase. And so you can see it gets complicated across the country. The new administration is coming in and saying, hey, we're going to try and centralize this a little more. We're going to try and help out the states a little more than they've been helped out, or in some cases a lot more than they've been helped out. And hopefully we can get something uniform across the country that people can understand when, where, and how they can get their vaccines. Because right now that's the confusing part. A lot of places have started to release vaccines to the next phase, which means people usually 65 or 70 plus, depending on the state, sometimes essential workers. But if you look at a lot of these states, there's really nowhere to go where they can really find out where to get this vaccine. Experts I talked to said the same thing, that when it came to that first phase of vaccinating healthcare workers, that was easy to do because they're all in the hospital system. Vaccine to the hospital, and they figure out how to give it to people. They essentially send out emails saying, hey, you need to come and get a vaccine, get an appointment for that. But once they get beyond that, especially, and I talked to an expert last week, once they get to that 70 plus age, then that gets more complicated because then they have to try and get the message out there, get it through their health system, get it through their doctor's offices. Sometimes these people, sometimes they don't have doctors, so they're not in the health system. How do you get it to them, especially in the more rural environments? That's the big concern. And so that's what they're having to deal with. And so that's where we are with the vaccine. Now, the other thing I want to talk about are what we're finding out more information about what's called the Longhaul syndrome. And these are people getting sick months and months and still having symptoms after recovering from coronavirus. And we've known this has been an issue, that people have been anecdotally talking about it. And some studies have shown, yeah, there seems to be numbers of people out there. But for the first time a study came out showing just how pervasive this is. This is out of Wuhan, China. If you remember, Wuhan's where this all started. And patients are hospitalized, almost 2,000 patients. 6 months later, they looked at them to see if they had symptoms, and it turned out the vast majority of them had at least one symptom. 63% complained of fatigue. The second symptom down was sleep. 23% complained of sleep patterns, 23% complained of anxiety issues. This, again, was 6 months later after being released from the hospital. So granted, these were very sick people, but we think long haul symptom might not just be with them, might be with people even who aren't hospitalized. And so another reason to protect yourself from coronavirus, because we know coronavirus can cause immediate issues. Now we know coronavirus can cause these longer term issues. We have no idea how long these are going to last, but the vaccine is here, which can certainly help out. But until you get the vaccine, and even after it, you still need to mask, you still need to social distance. Do those things you need to do to protect yourself and protect everybody around you, because getting the coronavirus, as we see now with these long haul symptoms, can be a long time period of trying to recover from it. Not something any of us want. So again, briefly going over the headlines again. Number one, the numbers. A couple days ago, they were record levels of cases, 278,000 cases in the country, 3,600 deaths. Those numbers have come down a little bit, and so that's good. The vaccine, right now the incoming administration is looking at releasing more vaccines to get people that first dose, with the hope that it can be manufactured fast enough to get people the second dose when they're supposed to. We'll see what happens with that. And then the symptoms themselves, the long haul syndrome, seems to be going further and further down the line. Now we know it's 6 months. People are complaining, and this is the majority of people who are hospitalized, are still complaining of fatigue. And muscle aches are in that category as well. 63% of people, 23% are complaining of sleep. Some are complaining of multiple symptoms there. So again, this is one of the things to keep an eye on, one of the things to be looking for, and one of the reasons to avoid coronavirus. And so what I want to do is go ahead and look at all the news this week. When I come back Friday for this next series of this, go ahead and answer the questions you have at that point. Go ahead and get more information over what the administration is going to be doing. I actually have a Facebook Live doc to doc with a doctor who is on the Coronavirus Advisory Task Force for President-elect Biden. So we'll get some information on that and find out what's going on there and what they're thinking, and have more information for you there on Friday. But in the meanwhile, I hope this week is a great week for you. And as always, please stay healthy and please stay happy. Thank you.
Are you a fan of our videos? Be sure to subscribe to Worldwide Campus News and Entertainment. Then ring the bell to see all notifications about the new videos and the latest video.